You want to get this fixed right away because it is a real pain in the butt.
Introducing the Paramena Bliss Podcast, a show dedicated to unraveling the mysteries of achieving optimal health naturally as you transition into perimenopause and menopause. Get ready to join your host, Dr. Seth Yates, an experienced naturopathic doctor, acupuncturist, and kinesiologist, as he shares his wealth of knowledge acquired from over 40,000 patient visits and 15 years in working with perimenopausal females. Welcome to the Paramena Bliss Podcast.
Hey, this is Doc Yates. Welcome to the Paramena Bliss Podcast, brought to you by PerimentalBliss.com. And today I want to discuss treating hemorrhoids in menopause and perimenopause. Now, this is something that tends to get worse around perimenopause and menopause, but generally for a lot of females kicks off with childbearing, delivery. It's the strain, that all that extra straining and stuff that often triggers it. And then at that point, it can be kind of come and go, and then often return during perimenopause and menopause. So right off the bat, I would say, if it's a severe case of external hemorrhoids, then any of these natural treatments aren't going to be enough to correct it. Just like when someone has very severe varicose veins, any natural treatments aren't going to be enough to correct it. Like I've seen ones that looks like bunches of grapes, they're so bad. That's not something where you take a few herbs and it goes away. But here's the thing, even if you get them banded or surgically corrected, the other ones can get worse because if there's another underlying problem that's contributing to this, like weak venous tissue, say problems with like liver, like it's not uncommon that you'll see that when someone has liver issues and that venous pressure backs up, making it worse, or if constipation and straining. These are all things that will contribute to it that need to be addressed still, even if you're going to end up getting them banded or surgery. So, without further ado, let's dive right in and discuss the top 5 things that you want to consider if you are struggling with hemorrhoids. Number 1, the most easy thing that you can find for an acute case is topical witch hazel. Virtually every pharmacy will have this. And witch hazel is an herb that's very astringent. And it means astringent, like think about when you suck on a lemon, it makes everything kind of pucker up and tighten up. Think of that as astringency. Witch hazel is extremely astringent and it makes the tissues tighten back up. So you don't just use it for hemorrhoids, you can use it for varicose veins, for something for astringency. Say someone has a swollen throat, or they used to call it like irritated vocal cords from talking too much. They call it a preacher's throat. These are all things where using more astringent herbs helps tighten and tone loose tissues back up. So, number 1, you can think of topical witch hazel. There's other herbs that are astringent that are very commonly used for hemorrhoids too, like horse chestnut, but it's not as easy to find. You have to go to a health food store to get that type of stuff, whereas witch hazel has been used enough and long enough that you can find it. Any pharmacy will have some sort of witch hazel extract that you can use topically for your hemorrhoids. Number 2, liver and vein herbs. So any herbs that you can use for liver and vein support, we often combine them all into one formula. So this is where you would take things like horse chestnut, collinsonia, and then combine it with liver herbs like bupleurum or milk thistle, or even something basic. It could be as basic as dandelion root. You want to be doing some sort of combination of liver and vein support herbs to help with venous drainage, venous flow, and make sure that there's nothing around the liver that's preventing or causing backup pressure into those veins. Number 3, this is a big one for a lot of people, stool softeners. If you are prone to constipation and then hard stools and straining that way, that will be a case where it's like, oh, my hemorrhoids are better, and then, oh, constipated, straining stool, and then it flares it back up, and it's like this constant coming and going of hemorrhoids that kind of matches the coming and going of your bowel movements. In those situations, we need to do things to soften your stool. Obviously, the most important thing is from a diet standpoint. We've talked about constipation many times before, but you want to increase fiber and increase water. Now, in the cases that that's not enough, 2 natural remedies that I have people use for this. One is just more magnesium that they can take before bed, because it helps with it helps people be more relaxed, makes you sleep better. And the side effect if you take too much is it makes your bowels get softer, get your stool a little softer. And it's not something where your body really becomes dependent on it. The other thing that works really good for this, because it is almost like a type of fiber, but it forms like a gel. It's called slippery elm powder. And that, I'd say probably any health food store that you get that. A lot of the times, though, they only have it in lozenges, which would be fine. But in this situation, it'd be better if you take it with a little bit more water than that. So they'll use what's called a cold water extract. You take a cup of cold water, you stir in this slippery elm powder, and you drink that just like you would for a Metamucil, which is something else that you could use, which is just a psyllium husk extract. Anything you can do to keep the stools soft. Now, at the same time, you don't want the stools to be so soft that they're, like diarrhea, because you will see cases where people have constant chronic diarrhea that will also flare up their hemorrhoids because they're going to the bathroom too much. So what we're looking for is just like that one formed bowel movement per day. It's formed, but it's soft enough that when the toilet flushes, it kind of breaks it up. That's the type of consistency that we're looking for. Number 4, overall straining, reducing overall straining. Especially this is for people that do a lot of like heavy lifting. If your work involves you doing a lot of heavy lifting, or say you are training with a lot of weights, especially things like squats and deadlifts, that is another common thing where you will see hemorrhoids flare up for people that do a lot of heavy lifts. Just because you're to support your back when you're doing squats or heavy deadlifts, you have to create a lot of internal pressure. Because that's what helps stabilize your core and your back. But people can create so much internal pressure that it basically blows out and creates hemorrhoids. So if you notice that you have, kind of irritation and it's after doing those types of heavy lifts, you need to adjust your technique and maybe consider pulling back on the real heavy stuff until you get this properly addressed. The 5th thing that you want to consider when it comes to hemorrhoids, pelvic floor work. Especially this is really important for females. Making sure that there's no issues with your pelvic floor, especially if it's like things that have always just lingered on ever since childbirth, especially if that childbirth involved anything like an episiotomy or scar tissue. Getting that addressed, though, you can find a pelvic floor physiotherapist that focuses on that, and they should be able to tell you like if they feel it's even playing a role within 1 or 2 visits. And if they're like, no, there's no major trigger points, scar tissue, or anything through here, then you don't have to worry about it. But if that is a major issue for you, you want to make sure that's addressed, because the pelvic floor is what supports all of that area. And if it's off or too tight or too loose, they can teach you how to do to train that. Because it's not often as simple as like, oh, I'm just going to do more Kegels. Because sometimes it's about you're not doing them correctly and you're basically creating trigger points and making certain areas too tight. And the other areas are not firing the way they're supposed to. So those are the top 5 things that you want to consider when you're dealing with hemorrhoids in perimenopause or menopause, so that you don't have to deal with this pain in the butt. I hope this was helpful. This is Doc Yates signing off.
Thank you for tuning in to the Perimenobliss podcast. Don't forget to hit the subscribe button and visit perimenobliss.com for more valuable information on how you can thrive during your transition through perimenopause. Join our community of like-minded women who are dedicated to achieving optimal health naturally, and stay up to date with the latest tips, tricks, and advice from Dr. Seth Yates. And we'll catch you on the next episode of the Perimenobliss podcast.